Good day, everyone. My name is Perova. I'm a professor of Biomedical Engineering Department, Kharkiv National University of Radioelectronics, and I would like to present to you a framework for developing a system for monitoring human health in the combined action of occupational hazards using artificial intelligence and IoT technologies. This work was made by researchers from Kharkiv National University of Radioelectronics and researchers from Kharkiv National Medical University. An occupational hazard is a hazard experienced in the workspace. Occupational hazards can encompass many types of hazards, including chemical, biological, psychosocial hazards, and physical hazards. It is necessary to study not only one occupational hazard, but it's really necessary to study the combined effect of physical hazards. For example, effect of low frequency electromagnetic radiation under cold stress on the immune system, the functioning of the reproductive system, shifts in biochemical processes, and changes in the endocrine system under the combined influence of these hazards. The principal idea of the theoretical foundation for developing a system for monitoring human health in the combined action of occupational hazards consists of few parts. The first step is experimental research on animals. Like animals, I mean laboratory white rats, WAG line. This research will stimulate a real condition on the product environment. Then the functional state of animals' organism under the combined influence of occupational hazards will be studied. This state will be described by a set of medical indicators. In the second step, the modern methods of intelligent data processing based on hybrid neurophase system alone obtained indicators that allow to determine the leading factor influencing together and to establish the critical significant indicators that will fully reflect the functional state of the organism in these conditions. And in the last step, it is planned to develop a system for dynamic monitoring of occupational hazard values and at the same time for simultaneous monitoring of certain informative medical indicators. In addition, it's proposed to use the system both for dynamic monitoring of levels of production factor and for simultaneous monitoring of certain informative medical indicators based on use of IoT and integrated cloud computing technologies. To achieve the main aim of the work, it's necessary to perform the following tasks: conducting the analysis of the impact of existing exogenous, biotic, abiotic, natural, and anthropogenic adverse environmental factor on human at work, carrying out of an experimental on animals in the condition of the combined action of various occupational hazards and description as the reception of data. Performing the study of modern methods of artificial intelligence that can be used for intellectual analysis of experimental data, including machine learning and deep learning methods. Carrying out of the intellectual analysis of the received experimental data with the application of methods of artificial intelligence, the corresponding conclusions, and development of recommendations. Analysis of modern technological solutions using IoT and IoE and cloud computing technological solutions for building a distributed monitoring system. The main technological features of human health monitoring system include the following: identification of the most informative medical indicators based on the conducted experiment on animals and the combined action of occupational hazards on them. Design of human health monitoring system with measurement of a limited number of the most informative medical indicators and occupational hazards. Uh, Containing digital data on the human condition, like electronic medical records, their coordination and exchange between the relevant parties within the monitoring system. Mobile access to information that ensures its receipt in real time and thus increases the productivity of the monitoring system as a whole. Remote monitoring technologies will promote the use of innovative models such as remote sensing and diagnostics. Generation of hypotheses based on the obtained data using artificial intelligence, machine learning, and deep learning models. The use of cloud technology provides a secure, fast, a cost-effective way to access, store, and share human health information between different stakeholders and multiple connected devices. Intellectual analysis of experimental data consists of few parts. At first, we should establish of hazards and indicators set. We can suppose that hazard set is the set of occupational hazards affecting the worker and can be expressed at set H. While the medical indicators measured from laboratory animals can be expressed like set MI, and among them some medical indicators are more significant than others. It's necessary to determine it for reflecting the functional state of the organism for further measurement it on humans. For this, we propose to use feature selection extraction method that permit to obtain a reduced number of medical indicators, the set F, where m is less than n. This method proposes to transform medical indicators using module of centering and normalization to the set C, where at next step we can calculate the first principal component using, for example, OS neuron or maybe a principal component analysis. It depends of necessity of online processing or maybe not. Then at module of distance calculation, we calculate the distance between principal component and normalized medical indicator, our feature. And those indicators that have the minimal distance to principal component became the most informative value. So at output of our system, we can see the indicators sorted by informative values. Each indicator that became most informative should be reducted from our data set, and the work of the system repeats. The number of most informative values can be defined by the physician and can be changed from one group to another. The development monitoring system should provide a number of important functions for the stable and efficient operation. It should be at first security along with confidentiality and data protection. It's an extremely important aspect of the health care, and it is the basis of trust in the provision and clinical services. At second, it will be automation of monitoring system management that can be provide an adaptation and prompt response to change in the network, as well as comprehensive control and compliance with the last security and resilience policy. Availability of different classes or of services when the priority of traffic associated with a particular healthcare application provided, then it is ensured that non-critical services do not dominate in the bandwidth consumption to the detriment of services related to monitoring. Traffic monitoring and analysis in order to classify, identify, analyze, and effectively manage network resources. Further combination of hybrid narrow fuzzy system for intelligent analysis of the registered time series of changes in human medical indicators simultaneously with the indicators of the production environment will allow monitoring of health in real time. So it's like in online mode. And our conclusions, the proposed framework is based on the development of a clear algorithm based on the informative evidence for the study and analysis of the functional state of workers, which will save lives, health, and efficiency in the process of their working. The introduction of modern information and communication technologies will improve the conduct of clinical and hygienic monitoring through a systematic analysis of the working environment and health of worker. It will modernize the principle of occupational risk management, including improving the development of preventive methods in the professional selection, help modernize accounting, and analyze the risk of occupational diseases. At the same time, due to easier access to medically important data information and communication technologies, provide new form of interaction between participants in the monitoring process. The transition to a fully connected medical IoT environment will significantly reduce data entry errors, and together with IoT security tool, increase its cyber resilience. In this context, reliable communication and interaction, along with mobility and the Internet of Things, are important tools for developing effective system for monitoring the state of human health in the working area. The developed system will further provide a highly qualified medical service and reduce the cost of diagnostic, treatment, and prevention activities. This framework fully satisfies the requirements of the work community to improve the system for medicine and labor protection, in particular those workers who perform high-risk work and work where there is a need for professional selection. Thank you very much for your attention.